Hey ladies, this is Mocha Mommy here bringing you another video. And on Saturday, December 5th, Keke Palmer announced her pregnancy to the world while hosting Saturday Night Live. And I've sat back, I made it a point to do my research because I wanted to cover Keke Palmer's pregnancy from the perspective of not just a Black woman, but as a licensed medical professional and also as a fan of Keke's and the Saturday Night Live show. I have been an SNL fan for decades. I'm so intrigued by the quick-witted comedy, the fast set changes, and the way that this show could really cover current events and create culture. So one of the things that I really like about Saturday Night Live is its creative process. One of those things that they do in the creative process is that usually by Wednesday, the cast is well aware of who's going to be guest hosting, and they start creating a bunch of scripts and scenarios. They then have the guest host come into the writer's room where they approve all of the different skits that they're willing to be a part of. And a lot of the scripts are not completely scripted out, but they're sort of like frameworks where they can ad lib so that way they're not pressured to learn everything line by line. And also the star, the guest host, can add some of their own personal experiences and jokes to the narrative. One of the funnier skits that was part of the show that had everybody talking Monday morning was a skit called Ultrasound. And in this skit, Bowen Yang reprised his character as being the fun, mischievous kind of fetus in utero, where Keke Palmer is then having a visit with her doctor. They're giving her an ultrasound, and they're seeing that kind of the twins in her belly be mischievous for joking purposes. But there was one part about this skit that really stood out to me, and that was when Keke Palmer had stated that she figured that the pregnancy must have been God's will because she had 2 IUDs and still ended up pregnant. And then you see the 2 fetuses on the ultrasound kind of pogo stick jumping on the IUDs. I had spoken about this before, that women who have underlying inflammatory conditions are very likely to have an IUD be displaced. Now, Keke has been very open and transparent about her struggle with PCOS, and it took a long time for her to get diagnosed. It's highly likely that there might be some validity to that statement about Keke Palmer having 2 IUDs planted and then still ending up pregnant. One of the things that happens with these underlying inflammatory conditions, IUDs can do one of 3 things. One, they can exacerbate the situation, making it really, really hard to manage, making your periods heavier, and causing your PCOS to flare up in other ways, from the skin condition to the joint pain, to the back pain, to the headache, nausea, all the things that come with PCOS. Another thing it can do is that the hormones in certain IUD brands, like Mirena, Kyleena, could possibly be enough to keep you nice and balanced, and then you don't have any symptoms. And then the third thing that could happen is those IUDs can be displaced. The constant inflammation of the uterus when you're under stress, when you have a difficult filming schedule like Keke Palmer, it could potentially cause that device to be dislodged. And even though you have indicator strings, if you have an underlying inflammatory condition, those indicator strings might not always be a sign of correct placement, simply because if you have things like PCOS and fibroids, those things can dislodge themselves. Also, pregnancy alongside of an IUD is not uncommon for women who have these underlying inflammatory conditions. For instance, the IUD is not properly placed, but then it becomes dislodged through the inflammatory process, and then that allows to have a pregnancy. You don't really know if your IUD is dislodged unless, 1, you have a transvaginal ultrasound machine in your home, or 2, you get pregnant. So these birth control failures are something that we really have to start talking about. And I'm not saying that this is Keke's situation, but underlying inflammatory conditions such as fibroids, such as PCOS, are something that you really need to be very transparent about, to your doctor about. if you're having other symptoms that can manifest itself as far as PCOS is concerned. Also, if those conditions run in your family, even if you feel that it's not affecting you, could be a factor in and out having an IUD placement and a conversation you may need to have with your doctor. Also, I highly recommend the blog Meals She Eats, which is basically an anti-inflammatory diet for women suffering from PCOS to help to maintain and manage a lot of those inflammatory conditions that PCOS can bring with it. Another thing that we as Black women need to be aware of, or women overall need to be aware of, is a class of drugs called pseudoabortives. Okay, these are active ingredients that are present in both prescription birth control as well as emergency contraceptives that could possibly lead to the medical abortion of a zygote, which is a fertilized egg, and it can stop it from implanting in the uterus. And because some people believe that life occurs at conception, the fertilization of the egg, that could possibly be up for legislative debate in 2023. So understand the active ingredients in your birth control, and perhaps some of those active ingredients could possibly be taken off the market in certain states. The research is not conclusive and the jury is not out, but it's not as if people who are ignorant don't vote, okay? Or people who are ignorant don't speak up, because that's the biggest problem. Ignorance is now troping science. So ladies, be aware of any active ingredients in your birth control and see if those active ingredients are up for any kind of legislative change or debate, and you want to discuss that with your doctor. We're also finding that lack of funding is becoming more of an issue. States that maybe abortion may be legal, but there is a high number of voters who don't agree with that practice. Also states who are limiting funding to programs like Planned Parenthood or other hospitals and clinics that perform abortion services. Those funds are beginning to dry up. Or when you cut funding to these types of clinics, you don't cut the amount of abortions. Many times what you're actually cutting is cutting women's access to getting healthcare, reproductive healthcare that they may need. It cuts and limits things like reproductive testing for infertility, any kind of testing for and screenings for cancer. It eliminates the amount of equipment they have access to for complicated or complex pregnancies or complex ovarian or reproductive healthcare issues. It also limits the amount of experienced staff they're able to retain, because typically experience draws money, and it then becomes harder to retain a lot of those experienced professionals. So ladies, in 2023, when you get your tax return, you may have to put some of that money towards your reproductive health, because it seems as if insurance companies, free clinics, doctors' offices, health insurance companies are starting to really get caught up in these legislative crosshairs where they may not be able to provide as many services or as much comprehensive coverage as they used to in the past. So be prepared in 2023 to maybe come more out of pocket for your own reproductive health advocacy. Another part of reproductive health advocacy is speaking up when it comes to dysmenorrhea. Okay, that is painful periods. Actress and producer Marsai Martin just made it public that she had to get an ovarian cyst removed because it was the source of a lot of her painful periods. She had been struggling with that condition for 4 years. And listen, it seems as if a lot of people who don't know anatomy, physiology, medicine, or basic science are always the ones who are the loudest. But ladies, this doesn't come from things like being sexually active or having STDs in every single case. A lot of these cases are genetic. They're underlying inflammatory conditions. Some of them are just an indicator of another endocrinological problem that you may have. So ladies, this is really important to have those conversations with your physician, with your pharmacist, and maybe even find a new one who might be more compassionate. Word of mouth is always a good source. But ladies, make sure you're advocating for your health, recording and keeping track of your period, even if you have to do it on paper, because we know period trackers. But ladies, I want you to be your own strongest advocate and making sure you're letting your doctors know what it is you want for your own reproductive health. This information may seem very overwhelming, but Stay tuned for part 2, and I can let you know some of the solutions that you can come up with and certain suggestions that I suggest that you ladies as healthcare consumers speak with your physician or healthcare provider about.